Joining us now, part of the Job Creators Network series that we have and the Job Creators Network Foundation. This plan they developed, so cool. I love it. It's been adopted by the White House. But now, you know what? We have to talk to real people and real doctors. Is this going to work? That's really the issue, because talk is cheap. Is this health plan that's been developed, healthcare for you, is it a reform that can work? Let's start by going to Dr. Nicole Johnson. She's a pediatric physician. Dr. Johnson, thanks for being with us.
Thank you for having me. I'm very excited to be talking about this with you.
You know, healthcare for you, which is a reform plan, what Elaine Parker, by the way, Elaine on our show all the time, great lady, and she's kind of the spokesperson for this. They put together a plan called Healthcare for You. And instead of going top down like Paul Ryan did and try to go through the bureaucracy, Dr. Johnson, what they did is they went to people. They went out in the country and they interviewed thousands of people, single people, married people, family people, non-family people, young people, old people, and said, what do you want in a health plan? What do you want? What are the elements? Then they went out and they talked to doctors and said, hey, can these elements work? Get your input. So they crafted this, Dr. Johnson, from the ground up, not from top down through the bureaucracy. You've been able to look at it. You were part of developing it. What do you think?
First of all, I think it's fantastic that I'm able to be a part of this. For so long, the doctors and the patients have been left out of this conversation. Reason why Paul Ryan and the rest of the group for 8 years after the Affordable Care Act took place had nothing was because they didn't do what Job Creators Network did and went out and actually did market research and talked to the American people to ask them what they want and talk to the doctors, like you said, to see if we can actually deliver something so simple, really, putting healthcare back in the hands of the patients to make a choice and leaving that relationship between the doctor and the patient sacred, what it was designed to be, without all the bureaucrats. It's that simple. But nobody else dared to do it in Washington. So very excited to be a part of this and have our voices heard. We're getting just as frustrated as the American people are with seeing all the lobbyists and the politicians and the bureaucrats make all of these changes and take charge of healthcare decisions. And we call it healthcare. Doctors, we call that healthcare. But what we actually are providing, we call it medical care between you and your doctor.
All right, Dr. Johnson, let's cut to the chase here. Medicare for all. I mean, this is the big rage. Warren's got it. Bernie Sanders got it. Chances are, this is going to be a presidential campaign topic. If they win, that's what they're going to advocate. Forget the $25 trillion or whatever it's going to cost. One of the biggest issues here, and I think it was in one of the Democratic debates, it was Congressman Delaney, right? That brought this out. I mean, I remember laughing my tail off when he said it, because it's like, what planet do these people live on? And Delaney says, look, I've talked to doctors and hospitals all in rural areas all over the nation. Your math doesn't work, because if you held the Medicaid fee, which is 60% of cost, every rural hospital in the United States would go out of business tomorrow.
And and if you think Medicare fee, it's 40% of what private insurance plans reimburse for. So how do you think you're going to, one, keep a doctor's office open with that level of reimbursement? And I can tell you, as a pediatrician, most of my patients are now, I'm actually employed in a hospital, so I can't really, disclose those details, but 80% of our population is Medicaid, so for our pediatric patients. And if we did not have the 20% private insured patients, we wouldn't be able to stay open and operate. So if we adopt a plan that covers everyone with the same government-sponsored plan, reimbursing 40% of what private insurance pays, which is less than even what Medicaid is reimbursing nationwide. There's no way we're going to be able to sustain that. There's not enough resources. Then when you get the doctors dropping out, because they will, you won't have your doctor and your local pharmacist. You're just going to have these big, giant corporate healthcare systems that will take over. You're not going to get personalized care. You're going to get all of these long waiting lines for every service. We've already seen it. We're seeing it happen in Canada. We're seeing it happen in the UK. Look at the VA. The VA is our own local homegrown system that's very similar to this. One single payer, government operated, and our veterans are dying, waiting for care. The American people do not want this. And Job Creators Network has shown that with the market research of over 25,000 people. We know it's not going to work.
Well, it's a disaster. And give me these numbers again. We're with Dr. Nicole Johnson. She's a pediatric physician, and we're discussing the Job Creators Network Foundation plan, healthcare plan called Healthcare for You. Go to healthcareforyou.com, healthcareforyou.com. So, Dr. Johnson, go back to what you just said earlier. I just want to get these facts straight. You said that 75% of senior citizens are getting their coverage through Medicare, and Medicare is only 40% of the cost. Is that what I heard?
Medicare reimburses at a rate of 40% of what the private insurers are reimbursing. So that's just Medicare alone, not even considering the supplemental plans that have private insurance companies supplementing the Medicare program. So just leaving it just with Medicare alone, no supplements, the reimbursement rate for medical, so your visit with your doctor, your visit to the hospital, whatever test you're going to get is 40% of what the private insurers are actually reimbursing.
Right. So if the private insurers are reimbursing $100 because it costs $100, right? That's
correct.
What the cost is. Medicare is reimbursing $40.
Yes.
So who's making up the $60?
Guess who? You are. The patients are.
The patients that are paying for the private insurance,
yes,
are paying also to subsidize those on Medicare who are getting it for 40%. So when I go to, when I pay my health care premium and I've got private insurance to take care of myself and my family, part of that money is going to the fund that closes the gap between Medicare reimbursement and actual cost. Correct.
Better known as subsidy. So the rest of us are subsidizing that. Also, the hospital or the medical care facility, the physician's office, your private practice physician out in rural Texas or anywhere, they have to either eat those costs. So and on top of having to pay the people that they employ to get the machine to work, to get your EKG that you need, or your lab test done, or the electronic health record that is mandated under the Affordable Care Act to keep running, and the technological service required with that, that office has to pay that additional coverage that Medicare is not covering. That's unsustainable. People are not going to be able to survive that way. So there's a better, this Healthcare for You plan, for one of the solutions is to, the major part of this plan is to put your money in your own pocket, so provide these health management accounts to patients. What people understand that now is a healthcare savings account, where you get you're paying into a high deductible insurance plan. You are able to save some of your money, your own money, pre-tax, into a savings account that you can use towards your payments for your visits to the doctor or medications. And but right now you have to be tied with an employer. The employer also does put in a small percentage of that too and contributes. But if you were to lose that job, that wouldn't be portable at this point. You'd actually have to go and get it employed with someone else who would pay into a healthcare savings account. What Healthcare for You would do is allow you to put your own money into a health management account no matter what employer you have. That employer doesn't have to provide insurance for you. You can actually go out and shop for the insurance plan that works for your family or the health plan that works for your family. And then if you decide to leave that job or you get fired, God forbid, and go and work somewhere else, you still have your healthcare savings account, and you can use that with your next employer, and your employer can actually put in money to that account, not having to pay for large insurance health plans, which is another great thing for small businesses and even small doctors' practices who have to provide a health plan for their employees. They will save money, actually, by only contributing to the employee's healthcare savings account and not having to pay the expense of this huge benefit plan that not everybody is gonna want or need.
I mean, Dr. Nicole Johnson, the way you're laying this out, it really makes too much sense, right? Ever have a conversation with somebody and say, well, that just makes too much sense, right? There's got to be a flaw here. There's got to be something I'm not getting, right? What am I not getting?
I don't see that you're getting anything. I think one of the biggest concerns that American people have is whether their pre-existing conditions are going to be covered, and so that's and whether the Republicans want people to die. You know what? This plan is a Republican plan. It should be a Democrat plan. It is a nonpartisan plan. We want everybody to be able to save on their medical care costs. Really, medical care is not as expensive as what it's put out to be. It really is cheap. You can get your medical care from a direct primary care physician or any other physician who takes kind of the direct payments from you to them for much cheaper. Say you have a family of 4, you could pay as low as $200 a month to see your doctor anytime you want, and to and as many visits as you want. Some of these direct primary care doctors are actually going to make house calls, meeting you at a place on the weekend or the evening. They are able to get wholesale prices for your medications and supplies that are a fraction of the cost that's negotiated with a big hospital or corporate system and an insurance system. So that combined with you having your own healthcare management account allows you to move from job to job and still keep your health plan and cover your pre-existing condition. It really is that simple. It's not. It does not have to be complicated. The only thing that makes it complicated is adding all the layers of bureaucracy and legislators and special interest groups adding into any plan that comes from the federal government.
All right, I've only got a couple more minutes. I'm with Dr. Nicole Johnson, pediatric physician. We're talking about the new healthcare plan adopted by the White House, by the way, called healthcareforyou.com. Go to healthcareforyou.com, the framework of it. But I want to get back to pre-existing conditions, because one of the big issues in the healthcare debate in 2017, which the Republicans lost the debate, lost the vote, lost the House, okay? All
Correct.
Because of the stupid debate that Paul Ryan did. I'm not a fan, all right? Can't stand the guy. Good riddance, go back to Wisconsin or wherever the hell he is. That was such a disaster, and they had no plan. But the big thing, I'm sorry, it really makes me upset when I think back on that whole thing. Pre-existing conditions was the big deal. We had
Right.
we had Republican congressmen going back to their town halls and people screaming, my child will die. I mean, this was real. And so explain again how this plan is going to protect people with pre-existing conditions without pricing them out of the market.
Okay. So a couple of things. So there are the regulations that are already existing that prevent insurers from denying coverage based on pre-existing conditions will not be changed at all in this plan. But what will happen is we'll give the states more autonomy to create this method to guarantee that these health insurance policies can't raise people's rates or drop them from coverage due to their health conditions. A lot of states right now already have these laws in place, but they're kind of moot under the Affordable Care Act because it really doesn't, because that is a federal regulation. So other states can actually amend their laws to actually include it at this point. So we're not taking away that part of the regulation at all. The states can also choose to set up their own risk pool models that can work for their population. And then the second part of it is the choice. You will still get the ability to choose your own healthcare plan, and you will have your healthcare management account that can be moved with you wherever you go, and you can still pay into that health plan directly from your healthcare savings account, no matter what employer you're with.
What if you don't have a healthcare savings account? What if you're living day to day, week to week, check to check, you're feeding your family, you don't have money in a healthcare savings account? Then what?
Then you have the option to go with a direct pay or direct primary care physician also, and you will still be able to have a healthcare management account. Your savings won't be as much if your employer is not contributing, but if your employer is contributing to that over mandating that you are in one of their healthcare sponsored plans, they're going to be saving more money and incentivized to actually contribute more to healthcare savings accounts for you.
All right,
but
Doc, I'm almost out of time. I've got a question here from a listener. Terry in Ashland, Virginia says, ask the doc, what happens if you lose your job and you're out of work for 2 months? What happens?
Your healthcare savings account is still yours. Your health management account is still yours. That money is still there.
So it goes with you.
Yes.
So you're not like the old days where you had to pay Cobra $1,000. Remember that was like thousands of dollars you had to pay for 90 days.
Yes.
Remember that? So that would go away, and you would just take this would have portability.
Yes, the health management account will have portability. Now I don't know if this plan doesn't sell. As far as I know, we don't have a bill yet, and in this plan it does not mention taking away Cobra itself. So if that is still an option, then that's still a possibility.
Cobra was an option.
That still is a lot of money.
Cobra was, we used to call it the executive option, right? Cobra was an option for senior executives, not an option for working men and women, because it was way too expensive, like $1,800 a month, and you just couldn't pay it. So it's a senior executive rich man's plan. Doc, I got to go. I love what you're doing. I want to thank you for your time. I want to thank you for fighting for this. Go to healthcareforyou.com. This plan developed by Job Creators Network Foundation. Elaine Parker, the spokesperson on it, has been adopted by the White. It's unbelievable what they've done.
Yeah.
And you've been right in the middle of it, Dr. Nicole Johnson, pediatric physician. Thanks for being with us. Thanks for all your work. Healthcareforyou.com. Healthcareforyou.com. Dr. Johnson, thank you. Have a great weekend. We'll have you on again.